Our next presentation is entitled Finer, Faster, and Wider. It's a fine time for CT. It's from Dr. Marcus Chen of the National Heart, Lung, and Blood Institute at the NIH. A graduate of the California Institute of Technology, he earned his MD degree at the University of Wisconsin-Madison and completed his residency in internal medicine and fellowships in nuclear medicine and cardiology at the University of Colorado School of Medicine. Since 2006, he's been at the NIH, where he is Assistant Clinical Investigator and Director of Cardiovascular CT. A longtime collaborator with Toshiba Medical, Dr. Chen's clinical and research interests include radiation reduction and technical development of new CT imaging methods and technology. He's published over 70 peer-reviewed papers and received numerous prestigious awards, not only in radiology, but also in cycling and snow skiing. I guess the snow skiing was in Wisconsin and not while at Caltech. Please join me in welcoming Dr. Chen as he discusses high-resolution imaging and the current Genesis Edition and ultra-high-resolution CT scanners.
Thank you for the nice introduction. I will start out with a case here. So it's not every day that you see a patient who's 6 years old who has dermatomyositis. This patient had recurrent lung infections, and the team requested a low-dose chest CT. And on this low-dose chest CT, they noticed this abnormal calcification involving his heart. And the team wanted to know, what other parts of the body, what skin manifestations, what muscle manifestations does he have? And they requested an ultra-low dose whole body scan from his eyes through his toes. And we performed this on the Toshiba Aquilion 1 Genesis. And the amazing thing is that the scan length for this whole body scan was over 5 times the distance of the chest CT, yet the radiation dose was only a quarter of it. And this is what you can do with high-end technology, with the Toshiba Genesis system. You can do very low radiation dose studies and be able to answer the clinical question. So at the NIH, we see rare diseases on a regular basis. And if you're not familiar with the NIH intramural program, it's the largest clinical research hospital in the world. And we were actually featured recently on the Discovery Channel. And the whole idea at the NIH is that if we can study rare diseases, and we can discover how to better diagnose them, we can apply those techniques to more common diseases. Because we're the premier biomedical institution in the US, it's been a great partnership to work with Toshiba and use the most cutting-edge technology available. So I've been privileged to work with Toshiba since 2009. When we started a cardiac CT program, we felt that the best way to image the heart was at one time with a wide area detector. In 2012, we upgraded to the Vision system, which has a higher temporal resolution. In 2015, we improved the optics, and we were also an evaluation site for model-based iterative reconstruction, or FIRST. And then last year, we upgraded to the Genesis Edition. Overall, with the Genesis scanner, we're able to reduce the radiation dose by up to 30%. Frequently, you don't get anything for free, but this is one thing that you do get for free if you have pure vision optics. The image quality is the same or better, but the radiation dose is significantly less. So at the NIH, it's important to have high-quality images, but also use the least amount of radiation possible. This is a patient, a 50-year-old female patient, who's on a new research cholesterol medication. And she gets a cardiac CT every year to assess whether the medication is halting progression of coronary disease or if her disease is resistant to it. So when we upgraded to the Genesis system, this scan, the cardiac scan, was actually 24% less radiation. And the current scan was ultra-low dose. This was an equivalent dose of 0.2 millisieverts, or the equivalent of 2 chest X-rays. So when we upgraded from the Vision scanner to the Genesis scanner, we did a quick evaluation. We looked at 110 patients who were having cardiac CTs, and they were matched for about the same body size, about the same heart rate, the same KV, tube potential, and scan length. And what we noticed is that overall there was a 26% reduction in dose when everything was matched. So it's 26% lower dose just from moving from a Vision scanner to a Genesis scanner, to a newer generation system. And overall, if you look at the radiation dose, so these are broken up into less than 0.5 millisieverts, less than 1 millisievert, less than 4 millisieverts. Basically, there's a shift for a higher proportion of scans that are lower radiation dose. So with model-based iterative reconstruction and improved optics, I actually think that we might be able to replace a traditional chest CT with an ultra-low dose, a traditional chest X-ray with an ultra-low dose chest CT. And let me show you how. So on the left is a routine standard chest CT. It's equivalent to 38 chest X-rays of radiation. This patient was involved in a research study, and we did a second scan at the same time using the equivalent dose of 1 chest X-ray. And this is what you get with traditional image reconstruction. It's hard to detect this early lung cancer. However, if you apply FIRST or model-based iterative reconstruction, you're able to buy back the resolution and make an accurate diagnosis. Also on the Genesis platform, actually, this is present on all Toshiba products, is single energy metal artifact reduction. And this technology allows you to remove any metal artifact from the image. This is a patient who has an implanted defibrillator, and the right coronary artery is obscured by the metal artifact. However, if you apply CMAR, the metal artifact disappears, and you're able to evaluate the coronary artery. So we looked at over 100 patients and looked to see how much of an artifact reduction is there. And when you apply CMAR, there's a substantial reduction in the actual size of the artifact. Here is another case. This is a patient with bypass surgery. And on the left, the metal artifacts cause the left internal mammary artery to be unavaluable. However, if you apply CMAR, that vessel is now valuable, and this patient does not need an invasive catheterization due to an uninterpretable CT scan. And overall, we've, in our experience, over half of the studies that were previously unavaluable due to metal artifacts are now completely readable. Now, when you have a CT system, you need to have a consistent image quality, especially in the emergency department. If you have an emergency department chest pain unit, the number one cause of medical malpractice is discharging a patient who actually ends up having a heart attack. And in the emergency room, you really can't control what size patient rolls through your door. So here's a morbidly obese patient, BMI 55, and with improved optics, with the Genesis system, and with model-based iterative reconstruction, or FIRST, we're able to make a confident diagnosis, and we can feel good about safely discharging patients from the emergency room. Now, I talked about some low radiation studies, but usually when you talk about low radiation, you give up something, you give up resolution. However, with model-based iterative reconstruction, you can actually buy back the resolution. So here's a patient with a left anterior descending stent, and if I zoom it in, with traditional reconstruction, it's a little bit difficult to discern the stent struts. However, on the right-hand image, you can now easily discern each of the stent struts. Now, so far, I've talked to you about software ways to improve resolution. I want to talk to you about new hardware. So if you were to go out and buy a new digital camera, you would probably want to buy a camera that has the most megapixels possible, but the highest resolution. So here's a picture of downtown Tokyo, and if you zoom up into one building, the higher the resolution, the more crisp the image is. You'll be able to see the finer details. Now, in medical imaging, in the CT world, there's been a quest to improve the resolution of the images. There's been work with inverse geometry CT, flat panel detectors. But how about if you can fundamentally change the actual detector itself? And I want to introduce to you a ultra-high resolution system called the Precision. And the difference between this system and other systems is the actual detector itself. So I have a schematic model for you here. And this is a 0.625 millimeter detector. And this is what's the industry standard for the size of a CT detector width. Toshiba scanners, the standard scanner has a 0.5 millimeter detector width. This new ultra-high resolution system has a detector width of 0.25 millimeters. So if you compare a standard detector width versus this ultra-high resolution, it's substantially smaller. And this is a model, but to put this in perspective, the next time you have a meal and there's a salt shaker on the table, shake out a couple of grains of salt. So a grain of salt, 3 grains of salt equal 1 millimeter, or about 0.3 millimeters for each grain of salt. The detector in this new CT scanner is smaller than a grain of salt, and this is a marvel of engineering. So I had the privilege of using a prototype version of this ultra-high resolution system in 2015, and we were able to scan over 100 patients, and we partnered with Toshiba to see what works and what doesn't work. I'll give you one example image here. This is a patient with metastatic bladder cancer with metastasis to the lungs. And there's crazy paving of the lung parenchyma. And it's unbelievable the type of resolution that you can get off of this system. We're able to visualize things that we never dreamed about visualizing before by CT. So overall, the new Precision ultra-high resolution scanner has been built from the ground up. There's a brand new detector, a brand new DAS, there's a brand new X-ray tube, there's a brand new gantry and couch, and the image reconstruction has been tailored for ultra-high resolution images. Overall, with a 0.25 millimeter detector, you have a resolution of 150 microns, or 50 line pairs per centimeter. In our initial evaluation, we had readers evaluate images at 2 different image matrices off the scanner, and where a lower scale is actually better, a 5 is non-diagnostic, and across the board, we felt that higher image resolution was better for small detail, for image contrast, and image sharpness. Overall, there are now 2 premium systems offered by Toshiba, and I've been very fortunate to have worked on both of them. The ultra-high resolution system was a prototype, and I'm very honored and excited that I had early access to this, but now the general public has access to such technology. Thank you for your attention.